Hello to every member of Amansie Youth for Development Foundation and also every member of American Society. I'm Samuel Usufojo, a medical student and also a member of Amansie Youth for Development Foundation. In our current state where COVID-19 has been the order of the day, as a medical student, it's very important that I come out with some of the ways to prevent contacting the virus and also educate the general public on COVID-19. Okay, so COVID-19 is a viral infection. So it's a virus that affects the respiratory system. In short, it affects the lungs and causes damage to the lungs. So what are some of the symptoms someone with COVID-19 will present with? The first symptom, according to the World Health Organization, is fever. It's an infectious process, so the person might present with fever. Another symptom is cough, and another symptom is tiredness. These are the three classical symptoms: fever, cough, tiredness. But then based on the severity, someone will have shortness of breath and even enter into a state of respiratory distress. Aside that, there might be other atypical symptoms like cold, have sore throat, and even COVID-19 is transmitted through air droplets. So it requires someone with the virus showing some symptoms like cough. The person coughs or sneezes, then the droplet that comes out falls directly on either in your nose or in your mouth or on surfaces. In fact, research has shown that the virus can stay on surfaces for a very long time, days to weeks. So you come into contact by touching the surface, and then you either touch your mouth or your nose, and then you inoculate the virus into those areas. COVID-19 has an incubation period of 1 to 14 days. Classically, people by the 5th day will start having the symptoms of COVID-19. Let's look at some of the ways to protect yourself from getting the virus. The first thing that I want to talk about is regular hand washing. As we talked about, when someone infected with virus coughs or sneezes on a surface, the virus finds itself on the surface. When you touch the surface, you have the virus in your hands. So when you introduce the virus into your mouth, your nose, or your eyes, you have the virus now. So it becomes important that you maintain regular hand washing. You wash your hand with soap and under running water. The second thing that we have to take into consideration is avoid touching your face, your eyes, your nose, your mouth with an unwashed hand. Because as you maintain regular hand washing, it becomes easier to adhere to this measure. Okay, so the third way to protect yourself from getting the virus is maintaining some form of a distance between yourself and anyone who is sick. Maintain at least 1 meter or 3 feet, that is or more, between yourself and anyone who is sick. The last one that I will talk about is staying in the house. It's important in this moment of our lives. It's important that we stay in the house. There's an opportunity for you to watch the movies you've been yearning to watch that you've not been able to watch. This is the time for you to read your Bible. This is the time for you to do something that you've been yearning all this while to do, but then you've not been able to do. Please stay in the house. Staying in the house is important because it reduces the number of people you come into contact with. Number two, when are we supposed to use face masks and when are we supposed to use gloves? According to the World Health Organization, there are only two places there are only two reasons to use a face mask. First of all, when let's say you are showing the symptoms of the disease, let's say you are showing the symptoms of COVID-19, and then to protect yourself and then your family members, you wear nose masks so that when you cough or you sneeze, you don't transmit the virus to someone closer to you. Number two, you only use nose masks when you are caring for someone who is sick. If you are caring for someone with COVID-19, that is if you are a health personnel and then you are caring for someone with the disease, that is when you are supposed to use nose mask. Not when you are walking around in town and you just put on your nose mask. That's not nice. The next one is, when are you supposed to use your gloves? The same thing when you are caring for someone with a disease. So when you are selling food, you are not supposed to wear gloves. When you use gloves, what you are doing is that you prevent regular hand washing. And what happens is that you pick up the virus from surfaces and then you transmit the virus to people through the money you are giving to them, you give them money, and then the virus finds some of the money, and then you are just spreading the virus. So it's become important that you only use the gloves when you are caring for someone who has the disease. Sum everything up, to bring everything to a close. My message to everyone out there is to keep calm. You just don't have to be afraid. I mean, there is no cause for alarm. The most important thing for us to take note of is that the number of cases recorded in Ghana here will have to go up. I mean, that is the normal care when it comes to epidemics. It's expected to rise and get to the peak, then it starts falling. But then another important thing that we have to be happy about, and even we have to take note of, is that about 80% of people who get the virus recovers. So I mean, there's no need to be afraid. And also, aside that, people who usually die of the virus are usually people of reduced immunity. People with comorbidities, they are usually people who die from the virus. If I talk about comorbidities, like people with HIV/AIDS, people with tuberculosis, and other diseases like hypertension, diabetes, they have reduced immunity. So they usually die from the virus. Aside that, most people who get the virus recovers. As I've said, that about 80% recovers from the virus. So there's no cause for alarm. Just hold on to your faith. As the President of Ghana said, that we know how to revive our economy when everything is over. I mean, by 2 months' time, everything will be over, and we will know how to revive our economy. But as to how to revive someone who is dead, I myself, I don't know. As a medical student, I don't know. So it is important that you stay home, keep safe. I mean, protect yourself from getting this virus, and then you all come out successfully. A.Y.D.F, the community, our priority. Bye bye.